When I had my MRI on May the 2nd, I hadn't been home but about an hour when I got a call from the radiologist to go to the nearest emergency room right now. I live in Fairfield, so of course Fairfield Mercy was like less than 5 minutes from my house, so I went there. They already had everything set up for me to be seen by a neurosurgeon. So I was transported from Fairfield Mercy to the Jewish Hospital Kenwood for my care because that's where Dr. Essell and his staff were located. And they are known for being one of the best blood cancer treatment centers in this area. And so that's how I became a patient here at the Blood Cancer Center. Dr. Essell told me that they suspected that I had multiple myeloma, but they had to do some more tests before they had a conclusive diagnosis. So on May the 3rd, I had a bone marrow biopsy, and I got the results back the following day, which confirmed that I had multiple myeloma. Dr. Essell assured me that he and his team of doctors and nurse practitioners here at the Jewish Hospital Kenwood would do everything within their power to get my multiple myeloma under control, and his goal was to get me in remission so that I could resume my life again.
We have a unique situation at Jewish Hospital. The 2,000 transplants just symbolizes that, but what we have here, no one else in the region can match. We have a specialized unit for blood cancer patients, and that includes patients that are getting aggressive chemotherapy and those getting transplants. And what that means is that we have specialized nurses that have training that no one else has. Our pathologists are hematopathology trained so they can make the diagnosis quicker and more accurately. We have specialized support staff. We have our own psychologist, dietitian, social worker, all that understand the unique needs of these patients. The other thing we have that no one else has besides the specialized unit is sometimes patients get sick or they come to us very ill. We routinely get transfers from other hospitals in the region that have aggressive hematologic malignancies. We have our own ICU. No one else has it. So our patients are never too sick to be treated with a specialist that understands the disease. If you're at any other hospital in the region and you get sick from leukemia, for example, you go out of the area with specialized nurses and you go to a medical ICU where you have great nurses that are trained in ICU complications, but they don't understand the disease. We have the unique situation here that we bring the critical care patients to the patient, but keep them in the specialized unit where they have all the support personnel and specialized nursing they need.
The day that I found out that I was the 2000 transplant was the day that I actually had my bone marrow transplant, and it was truly an honor and a privilege to know that I was under such good care and that I was going to be recognized for being the 2000th patient that had received a bone marrow transplant here at the Blood Cancer Center. So they had balloons and they had cake and punch and candy and all types of goodies, and it just really made my heart melt. And my mother and my sisters were here, so we got some pictures with them as well, with Dr. Essell. So it just really made me feel good that I was going to be recognized and that I was actually the 2000th recipient that was treated for a bone marrow transplant here at the Blood Cancer Center.
We've done over 2,000 transplants, and that doesn't include all the patients that fortunately don't need a transplant. So many of the leukemics, if they're a good risk, for example, can be treated with chemotherapy or those with other diseases. So the numbers are probably 10,000 that have been treated here.
Quality of care here was excellent. I mean, I felt like I was a guest at a top-notch hotel. I mean, the nurses, they were just phenomenal. They met my every need. There wasn't anything that I needed that they didn't provide for me. They were exceptional, every single one of them.